This video is going to demonstrate a half limb wound bandage placed on our equine patient. This bandage can be used both on the front and hind limb. The important thing to note on this video is how the various bandage material is being applied to the wound. So first we're going to start with is our wound dressing, which is commonly a Talfa pad that has an antibiotic ointment on it that's going to be placed directly over the wound. Obviously this horse does not have a wound, so we're going to simulate this horse does. And then that wound bandage, the Talfa pad, is going to then be secured to the limb using the white gauze, which is commonly referred to as cling. This cling is a nice material that has some stretch to it, but it also lays very nicely over the wound dressing and will actually cling to itself once it is completely placed on the limb. So you can see here our wound is small, so we're not going to be running our cling up and down the entire limb, depending on the size of the wound, on what size of wound dressing you're going to be used. So now our next step is to cover our wound dressing with a padded material. This helps secure the dressing, the wound dressing in place, plus also protects it from any outside trauma. Now notice as this bandage material, all of it is being placed on, there's a certain direction you want to place the material on. As you're looking from the horse from the side, you're going to be placing it from front to back. It's going to be the same thing on the contralateral limb, from the front to the back. Some people like to refer to as going counterclockwise on the left limb, clockwise on the right limb. Now we need to secure our padded outer shell. So we're going to now use a material called brown gauze. This brown gauze is an inelastic material, so it allows us to be able to place some tension on it to help us to secure our bandage to the limb. You notice he kind of started on the more distal third of the limb, and he's going to work his way downward on the limb. What's important as he's moving downward on the limb is that you want to keep this brown gauze is referred to as wrinkle-free as possible. Notice he's putting some tension on the brown gauze. This helps the bandage to conform to our limb and also helps create a nice outer shell to protect our inner bandage and wound. Also note that some of the padded material was left exposed from the brown gauze. We don't want to place the brown gauze directly over the skin with this amount of tension we're placing. Otherwise you could create some circulatory problems. So you want to keep approximately 1 inch of the padded material, which is the combine sheet as we call it, exposed on the bottom as well as on the top of the bandage. You can see once he has reached the bottom there, he's working his way back up, taking care to make sure that the brown gauze has no wrinkles on it. So again, it's important not to get in a hurry when you're placing a bandage on the limb. You want to put it on carefully and precisely. This will reduce any problems that maybe develop as a result of the bandage itself. So you can see this brown gauze has compressed our padded combine material, making it conform nicely to our limb. In some situations, depending on the patient's compliance, sedation may be needed at times to be able to apply a limb bandage. Now, once we've got our brown gauze in place, we're going to apply an an elastic self-cleaning outer bandage material referred to as vet wrap. You may have had this applied to your arm when you had to give blood during your physical examination. Sometimes, in some cases, it will tear on you, but that's no big deal. It will clean itself and it will just continue with the remainder of the roll. And in most cases, it takes the entire roll to complete the bandage. You can see this material really likes to cling to itself, which makes it an excellent material to use as your outer shell of your bandage. Again, notice that care is being taken not to place any wrinkles while we're applying the bandage material. Again, we're applying this in the same direction as we did the other bandage material. Looking at the horse from the side, it's going to be coming around from the front to the back. We'll also use this type of bandage for limb support, the distal limb, in the exact same manner of application. The only difference is no wound dressing is placed underneath. All right, once we have completed the outer shell, we are going to now enclose the top and bottom of this bandage with another adhesive material that we commonly use. Again, take note that we left some of the padded bandage material exposed on the top and bottom. This gives us some padding from our outer shell. And we're going to do this as well as on the bottom as well. Here you can see we placed elasticon, half of its width on the bandage and half of it on the skin. Again, we do not want to put a lot of tension on this, as the only purpose of this is to seal the bandage from any dirt and debris. So we'll do this both on the top and on the bottom.